Understanding a different reality. Psychosis is a complex mental state that can profoundly affect a person's perception of the world around them. It is not just a single symptom but a collection of experiences that can vary greatly from one individual to another. Psychosis is a state of the mind where thoughts and feelings change greatly. This altered state can make it difficult for someone to distinguish between what is real and what is not. They might see, hear, or believe things that others do not, which can be both confusing and frightening. A person might lose touch with reality, experiencing confusion and fear. These experiences can be overwhelming, leading to a sense of isolation and distress. It's important to understand that these feelings are very real to the person experiencing them, even if they seem strange or irrational to others. Their senses can change, leading to hallucinations and delusions. Hallucinations involve seeing, hearing, or feeling things that aren't there, while delusions are strong beliefs in things that are not true. These symptoms can disrupt daily life and make it hard to function normally. Psychosis is not an illness itself but a symptom of something else, like a high fever indicating an internal issue. It can be a sign of various underlying conditions such as schizophrenia, bipolar disorder, severe depression, or even physical illnesses like brain tumors or infections. Many factors can cause psychosis, signaling the brain needs help. These can include genetic predispositions, traumatic experiences, substance abuse, or extreme stress. Understanding the root cause is crucial for effective treatment and support. Understanding this condition helps us respond better and reduce fear and stigma. By educating ourselves and others, we can create a more supportive environment for those affected by psychosis. This can lead to better outcomes and a higher quality of life for everyone involved. People with psychosis need support and understanding, not judgment. Compassion and empathy are key in helping them navigate their experiences and find the help they need. Professional treatment, combined with the support of friends and family, can make a significant difference. Learning more about psychosis helps everyone involved and makes it easier for people to seek help. Knowledge empowers us to break down barriers and build a community where mental health is openly discussed and supported. Together, we can make a positive impact on the lives of those affected by psychosis. Sometimes psychosis starts slowly, with subtle signs. It can be difficult to notice at first, as these signs might be mistaken for normal stress or changes in mood. However, paying close attention to these early indicators can make a significant difference in getting the right help early on. A person might seem different with changes in behavior and thinking. They may become more withdrawn, avoiding social interactions and activities they once enjoyed. Their thoughts might seem scattered or disorganized, and they could have trouble concentrating on tasks that were once easy for them. Early signs include withdrawal from others, anxiety, and trouble sleeping. These symptoms can be accompanied by a general sense of unease or fear, and the person might express feelings of paranoia or suspicion without clear reasons. They might also experience changes in their sleep patterns, either sleeping too much or having difficulty falling asleep. This stage is called the prodromal phase. During this time, the symptoms are not yet full-blown psychosis, but they are warning signs that something is not right. Understanding this phase is crucial for early intervention and can help in managing the condition before it progresses. Not everyone with these signs develops psychosis, but they indicate a need for help. It's important to approach the person with empathy and understanding, offering support rather than judgment. Encouraging them to seek professional help can be a vital step in their journey towards recovery. Early intervention can prevent worsening. By addressing these early signs, healthcare professionals can provide treatments and strategies that can mitigate the severity of the symptoms. This can include therapy, medication, and support groups that offer a safe space for sharing experiences and coping strategies. If you notice changes, talk to the person or a trusted adult. Open communication is key. Express your concerns gently and listen to what they have to say. Sometimes just knowing that someone cares can make a huge difference in how they feel and their willingness to seek help. Early advice and support can make a big difference in recovery. With the right guidance and resources, individuals experiencing early signs of psychosis can find a path to stability and well-being. Remember, early detection and intervention are key to making a positive impact on their mental health journey. Why does psychosis happen? There isn't a single answer. It often involves a mix of genetic, chemical, and structural brain factors. Stressful or traumatic events, difficult childhood experiences, and drug use can trigger psychosis. Usually it's a combination of factors, not just one. Understanding these causes helps doctors find better treatments. If someone might have psychosis, they need medical help. A psychiatrist or mental health professional can help. They listen carefully, ask about thoughts, feelings, and experiences, and may talk to family members. They observe behavior and rule out other causes with medical tests. Using diagnostic manuals like the DSM or ICD, they make a careful diagnosis. A clear diagnosis helps plan the right support and treatment. Psychosis can change daily life significantly. Relationships with family and friends can suffer, leading to loneliness. Work or school becomes challenging due to concentration and memory issues. Stress worsens symptoms, making tasks tough. Emotional impact includes fear, confusion, and isolation. Understanding this distress helps offer better support. Stigma and misunderstanding make things worse. Education is key to reducing stigma and creating a supportive environment. Effective help is available for psychosis. Treatment involves a team approach, often including medication and therapy. Antipsychotic medicines reduce symptoms like hallucinations and delusions. Talking therapies like cognitive behavioral therapy, CBT, help understand thoughts and develop coping strategies. Social support from family, friends, and support groups is crucial. A mix of treatments addresses different needs. Medication plays a vital role in managing psychosis symptoms. Antipsychotic medicines work on brain chemicals to reduce hallucinations and delusions. Finding the right medicine and dose takes time and careful monitoring. Side effects are managed with regular checkups and open communication with doctors. Medication is helpful, but therapy and holistic support are also crucial. Cognitive behavioral therapy for psychosis, CBTP, helps make sense of experiences and develop coping skills. Family therapy and psychoeducation improve understanding and support. Community mental health teams provide ongoing support for daily life challenges. Self-help strategies and peer support groups empower individuals and reduce isolation. Recovery from psychosis is possible and personal. It is a journey that varies greatly from one individual to another. For some, it means a complete remission of symptoms, while for others, it involves learning to live a fulfilling life, despite the presence of some ongoing symptoms. The path to recovery is unique and deeply personal, shaped by individual experiences, strengths, and support systems. It means different things to different people, from symptom-free to living well with mild symptoms. Some may find solace in creative outlets, while others might lean on their community or family for support. The key is finding what works best for each person and embracing the journey with hope and resilience. Early treatment and ongoing support are crucial. Engaging with healthcare professionals, attending therapy sessions, and participating in support groups can make a significant difference. These resources provide not only medical assistance but also emotional and psychological support, which are essential for a holistic recovery process. Self-management, spotting early warning signs, and having a plan for tough times are important. Developing coping strategies, maintaining a routine, and practicing mindfulness can help manage symptoms and prevent relapses. Journaling, meditation, and planning can be powerful tools in maintaining mental health and well-being. Understanding of psychosis is growing, and treatments are improving. Advances in medical research are leading to better diagnostic tools and more effective therapies. Scientists and medical professionals are continually working to uncover the underlying causes of psychosis and develop innovative treatments that offer hope for a brighter future. With the right help, people can rebuild their lives and find new meaning and happiness. Whether it's returning to work, pursuing education, or engaging in new hobbies, the possibilities are endless. Reconnecting with loved ones and building a supportive network can provide the foundation for a fulfilling and meaningful life. Remember, help is available, and recovery is achievable. No one has to face this journey alone. Reach out to mental health professionals, support groups, and helplines. Encouragement and assistance are just a call or a conversation away. Embrace the journey with hope, knowing that a brighter future is within reach.